smart hospitals and hospitals of the future. And we were thinking about it both from the aspects of people who make the investments to make these hospitals capital efficient and giving them returns that they're expecting. Okay. We were going to structure it across 3 different aspects. The first one was looking at how to make hospitals more capital efficient for investors and how to use technology and better infrastructure to achieve that. And then also from the aspect of looking at it from how to make use of resources, particularly talented resources, which is hospitals and doctors and to some extent nurses. How do we make use of them better? And how do hospitals evolve themselves to take advantage of the limited number of people with specific talents that are available? And thirdly, how do we all bring this together from the experience of the customer and the patient so that the hospitals at the end of the day deliver the product and the service that the patient is looking for? So on that first topic of making hospitals much more capital efficient, Gautam, what do you think are a few things that hospitals in today's world are doing well, and what are some opportunities for further improvement for the future?
So, making the, improving the return on capital for hospitals is very, very important, because all of you know that the margin pressure in hospitals is very high and very difficult to make money with the traditional ways or what you want to do. So a couple of things. It's not rocket science. It's just some simple things like, are there ways in which you can remove your non-value added services for which you are spending? For example, in a hospital, the area is precious. Okay, so the square feet is precious. Can you remove some non-value added services from your premises and put something which is more valuable to the patient? So that's a simple thing. Now, that logic can be used for any of those services which you can outsource. So that's an example. The other thing is that in a hospital, you will find that many things are duplicated because of multiplicity of surgeons, because of different practices, different protocols. So if you can combine it, so for example, there'll be 5 people and they'll want 5 different kinds of equipment, and each equipment will be used 40%. So percentage utilization is 40%. So is there a way to combine that and have maybe 3 or 4? Now, it's easier said than done. It's not easy because, every person has their individual preference and individual styles, but that is something to look at if you can look at it in a holistic manner. And some things like, the standard way, what you say in any organization, the more you consolidate, the better it is. So if you can consolidate your equipment, your suppliers and things like that. So that's one thing. The other thing is that a large amount of capital is spent because people want to buy the high-tech stuff, okay? And do we need the high-tech stuff? Yes, we do. We need the high-tech technology. But do I really need a Rolls-Royce? So that is a decision which everybody needs to make. Because what happens is, and I have come from a equipment company, devices company before. Now I'm in a hospital. So obviously when you are making the product or device or an equipment, it is the best as far as you are concerned. It is the best in the world, and there is no reason why a hospital cannot use it or should not use it. But from a hospital perspective, do I really need it? So that is something which the hospitals need to be a little careful about, that maybe I'm going against the grain here a little bit, that should I spend top of the line? Maybe I should, maybe I should not. The other thing is, many of these processes there's a lot of capital spent. May not be huge capital, but even if it is in small chunks, it is spent on certain procedures which are done in the hospital. And is there a way you can automate? Is there a way you can standardize? And you will find an answer from many clinicians, no, it's not possible. Why? Because medicine is an art, it's not possible. True, but 90% of it, 80% of it, can it be done? So, things like that. So those are some ways to think about it. And the other aspect of just the metric, if you go after the metric, there are 2 or 3 metrics you go after. Average length of stay, percentage utilization, and the moment you do that, and your break-even times and all that, you are fine. If you just look at those metrics carefully, I think you'll be in a good shape.
So on the aspect of metrics, one of the things at least we at Stan Chartered investors in Fortis Healthcare, and a metric that they focus on with a lot of depth and attention to is ALOS. How do you think about options or methodologies to improve your ALOS ratio? And how do you relate that to also improvement in average return on the operating bed, or RPOB as they call it in our hospital terminology?
So I think, look, ultimately as investors, the one word that we love is ROCE. The one word that doctors don't like is ROCE, right? I think they want to get the best quality, and patients deserve it in many ways, right? In terms of the metrics per se, while we look at ALOS, one way to reduce ALOS is to remove some of the non-critical or lower revenue generating items out of the hospital, right? And this is to the same idea that Gautam had mentioned. I mean, for example, one of the companies that we've invested in, which is NephroPlus, which does dialysis. For most hospitals, it is not something which is not very high revenue generating. While the ALOS is low, it's still something where if you had those 10 beds and use them for cardio or use them for more specialized procedures, it would be something which would work better. So we're seeing a lot of hospitals now willing to outsource that non-value added service, right? So, and for the company that does the outsourcing, it works out quite well because they are able to get benefits of scale. They obviously have the better understanding of the technology. And in this particular example, nephrology, there are around just 1,000 nephrologists in the country. So being able to then pool that resource across various hospitals becomes something which is quite powerful. And that clearly then helps the ROC both of the hospital and also of the entity that's outsourcing it. I think the other thing, again, relating to both metrics and a point with respect to how expensive equipment you want to get. What we're also seeing now is some people playing it quite smartly, which is they get the top-end equipment and run a set of chains using the top-end equipment and charge that price premium, and then use the next level equipment in their own, in another brand which works under them, and where people realize that it is still good, it is still safe, but maybe not 100% of the quality, so to speak. It's 80%, but it's completely safe. And so that way, you're able to manage your price points and get good enough ROC both on the first product, which is not the Rolls Royce, but the BMW, and maybe the second product, which is, say, a Toyota, which still works and is quite good. So I think those two elements I feel are important from an ROC standpoint. The last thing I'd say is also coming back to both of your past experience in devices. So the right sort of medical devices which then help monitor patients when they're out of the hospital, so that they don't necessarily come in for things which are not critical, or on the other side, on the flip side, when it does get critical, you're able to get the person in quickly. Again, it helps manage your metrics to make sure that when a person comes in, it is for something which is critical and also therefore high revenue generating.
That makes a lot of sense. I mean, the other thing that, at least from my experience at Fortis, that I've noticed is, in order for you to improve operational efficiency and ultimately return on capital of a hospital, you almost have to think about it from a process efficiency standpoint and think about it end to end on how to create a cycle with very few bottlenecks. One example of that is we have to think about the patient experience right from the time he comes into the hospital till the time he leaves. And how do you think about bottlenecks on different steps of the process from the beginning to the end, and how do you remove those bottlenecks? For example, the radiology service in a hospital has to be specific and of really high quality for you to actually diagnose the issue properly. Then you'll have to have operation theaters which are, for example, modular or flexible so that there's no bottleneck at the operation theater level. And if you think about automation, which is an example that both of you has to some extent touched upon, how do you use automation, for example, robotics, to be much more precise in some of the procedures that you're carrying on to reduce the length of stay? And there are examples or experiences that Fortis has had where it has been able to reduce the length of stay from 6 to 7 days on certain procedures to almost 1 to 2 days, which is a significant improvement in the A-loss. And then get the patient home faster so that he can also maintain the quality of life or return back to his original quality of life. What does the hospital get in return for all this? You're able to be much more efficient on the number of beds that you actually provide to the patients while getting the same level of productivity or revenue generation from that hospital ultimately. And then finally, how do you think about post-operative care, not just at the hospital level, but also at the home level? And this post-operative care has to be very closely integrated with the hospital itself so that it's not a standalone entity or a standalone service that's not done in coordination with the doctor that treats the patient. So it has to be a full cycle experience, and bottlenecks have to be thought about at individual levels across the cycle. And that significantly helped my certain specific hospitals at Fortis according to my experience. So I'll move on to the next aspect of developing a smart hospital, which is how do you utilize the talented manpower that you have in hospitals, specifically doctors. And here, Gautam, I want to talk to you about technology that is currently being used in hospitals, and what kind of technologies are these, and how useful are they to ensure that we make use of the resources of doctors, particularly radiologists and certain specialists, which are not available to the extent that we would like them to be.
So this issue of lack of, or whatever, a big gap between the requirement of the professionals versus what exists today, it's a real serious problem. And so one thing is the people you have, they will be a little overworked, and then you have a gap. So it's a tough situation. But some things you can do. For example, let me build on what you said. One of the things from a hospital perspective, from my perspective, I know many of you are investors here, and so look at the capital and the investment and so on. But from a hospital perspective, that's not the first thing you look at. From a hospital perspective, first thing I want to look at is the care of the patient. That the patient needs to come in and leave healthy, safely, faster, and of course at a cheaper cost. So you twist the metrics a little bit. The moment you do that, then you have many things. For example, the problem of the shortage of doctors. In radiology, one of the things is that if you come for a diagnosis, you go to the radiology department, you get some scans, you get some tests done, and then you have to wait to meet the consultant, because somebody will have to read it, then somebody will have to diagnose and give you an opinion. And then based on that, your treatment will start. There's a simple technology called PACS, which I think many of the hospitals use, but we were among the first ones to use it, is that, firstly, you don't need to write, you just dictate, and it converts into the text. And that is now available online to all the consultants in the hospital. So for example, if I have done a test in my radiology department, a consultant sitting in OPD can access that. So quick turnaround time there. So what happens is the person who would have taken maybe 10, 15 minutes, 20 minutes is now able to do it in 5 minutes. So that's an example. The other thing is a lot of use of analytics. So when you use a lot of analytics there, you tend to make things a little simpler and faster. There is no running away from the fact that there is a shortage of people, so that we cannot shy away from. But what we can do is, I'll tell you an example what we do, not so much from the technology point of view, but from a perspective of, the people say that doctors are short supply, nurses are short supply. Yes, but the technicians are also short supply. The allied health professionals are short supply. So you can have a doctor and a nurse, but no technician, the equipment won't work. So think of it from that angle. So for example, we many years ago started a course for teaching, allied health professionals. And the trick is they need to get placed. So because now they've been getting placed, this program is running, and so you build the talent pool, if I can say so. From the nurses shortage point of view, it's a little irony here. We say that if it was an economics class, I would say there is a shortage. Of course, there'll be, many people coming in to supply. But nursing colleges, the College of Nursing, have many, many seats which are vacant. Of course, not ours, but in the country. And if you dig deeper, the reason for that is that it is not such a cherished career from an economic perspective, because it's probably easier to do a little less physical work and earn more in another environment. So that's one example. Now you look at from the doctor perspective. So one, of course, there is a shortage of medical colleges and so on. But even the graduating doctors, the MBBS, the number of seats for post-graduation are really low. So that means there is an artificial bottleneck. So there is a little problem. And it is, of course, tough to be a doctor. It takes long time. It's a lot of hard work to be a doctor. So from that perspective, what can the doctor do? You can use telemedicine, you can use remote monitoring, or you can use the consultant or the doctor only for high value added services which you can offer. So to build on what Vijay said a while ago, when you look at the healthcare continuum, of course we look at, we are a super specialty tertiary hospital, but preventive is one part of the chain. So there's preventive healthcare, then there is diagnosis, then there is curative, and then there is something else, which is at-home services. So there is a lot of room to develop the care at home services. So when we started this, I think, almost 8-10 years ago. It's been building up, and it is succeeding because it is linked to what he said, linked to the medical professional in the hospital. So the medical professional knows what is to be done, he is advising, and the patient is choosing. So if you can de-link those, and the other example is, if you can identify, he gave an example of robotics, but there are other examples of short stay surgeries. So which, many surgeries are now less than a day. Why do you need a hospital for that? Really speaking, he gave an example of nephrology, but I'm giving an example of daycare surgeries. You really don't need to come to a super specialty tertiary care hospital for a daycare surgery. So you can do it in a short stay service center. So those are the things, if you look at it, it is easier to manage the talent gap, because then you are focusing your really critical talent on what is delivering high value, and the rest you are, making sure the other people are doing. So there's no short answer to it, but that's probably, that is.
So that's quite useful. And Karthik, in the nephrology business, how serious or acute is the problem of appropriate manpower? And what are the steps that your investment company is making in order for them to address this issue?
No, absolutely. I think it's a huge problem at all levels, right? So right from the doctor's perspective, I think India has around 1,100 nephrologists, and we need 25,000 to cover, if you want to adequately cover all the patients who have chronic kidney disease. So, and also the challenge is, it's not just on the numbers. Even if we had the 20,000, what you'll find is a lot of them are located in the metros and, in cities that they'd prefer being in rather than in the smaller cities. So one of the things that Nephroplast and a lot of other nephrology chains are doing is telemedicine, right? So if I had to bet on one thing or invest in one thing or something that makes the life for a doctor easier, because he or she, it's difficult sometimes to convince them to adopt it, because it's new technology. They don't know if they're going to be able to provide the same advice to them over the phone or over the web. So the right technology which convinces both the doctors that he or she can provide adequate care, which then prevents them from having to travel to these to other locations and also optimizes for their time. So, so on the doctor's side, I think the only solution, unfortunately for us, is having a way to remotely manage patient care. And this is, I'm talking in the next 3 to 5 years. Hopefully, post that you'll have more professionals and the like. On the mid level, I think we see that too, right? In terms of to have the right sort of technicians, even to put the needle into the patient when they have to get onto dialysis. That itself is an art. And what we're seeing a lot of single specialty chains do is now have their own schools, right? And these schools are no longer. Earlier, they used to be something that you could sell on, or sell to an investor, or sell to someone else on. Now it's a prerequisite. I mean, you need to have internal training. You need to have that quality, be it in any of these single specialty chains. And many of these guys have done it quite well. So again, it helps in the retention. Being single specialty helps because you know that there's a path within the organization, and also it becomes a little more glamorous than just, I agree, sometimes it just goes empty. So identifying the right people is also important. The last thing I'd say, and this is not restricted to nephrology, but to any of the other specialties, is using analytics to identify the people who can take on more capacity versus less. So, we always have star doctors. We have star, we know for cardiology, XYZ is a star doctor, so on and so forth. The question that we always ask is, do you know who your star technician is? Do you know in your hospital or in your setup, who is the person who can handle 20 without compromising, care? There might be someone else who can only do 10, and you ideally want to be at 15. So managing that is important, so that even though you have less talent, you know that the person who can do well is given the right target and obviously rewarded appropriately. Because that helps you in your retention front, because you retain the stars and they continue to be in a segment that they're well trained for. But for the people who are now learning or maybe not as productive, they also have a goal to aspire towards. So the use of analytics, while we use it on patients, or we should be using it more on patients, should be using it more in other areas. One area where we feel it's quite powerful is to use it within your technical staff itself to see how good or bad they can perform, and then allocate responsibilities accordingly.
Just add one thing to your... I have a little different view on telemedicine. Little different, not too much. So telemedicine is an answer, but we need to find an economic answer to telemedicine. So what I mean by that is that, the patients consult a doctor because of the doctor's reputation. So, and it builds on that. And the more reputed the doctor is, the fees of that person keeps rising up. And when the consultation fees is rising up and the time for consultation is reducing, so you can imagine a consultant with people sitting outside his office. He really has no time for telemedicine, because telemedicine is focused on people who are not in that city, maybe in tier 2, tier 3, where the paying capacity is a little low. And so there is a little bit of a time he may have to spend, maybe 10 minutes more or 5 minutes more or whatever. So this fellow will get more paid in a direct consultation versus telemedicine. So how do you put telemedicine? So the answer to that, at least my thought on that, is that the credibility of the people who are offering telemedicine as an institution is more important than the doctor who is advising. So that's one point. And second point is that there are many doctors in the country and many hospitals. Like we say that there is a shortage of beds, but you have many hospitals which are unoccupied. You know, occupancy levels are 50, 60, 70%. So obviously there's a mismatch. Similarly, there are doctors, but some of them are not so busy. So if there is a way of catching those guys, ensuring quality and the credibility of the person who's advising with the economic argument, then it will succeed. But otherwise, it can just be used only for routine follow-ups and, maybe for some minor diagnosis. So.
Well, I absolutely agree. I mean, you're not going to get the star doctor to do telemedicine, right? It has to be the next level of doctor, or someone, as you rightly pointed out, who has the adequate training to at least get the initial diagnosis. And then let's assume it is something which cannot be solved through that route. Then it can be escalated in the right manner. But I agree. I mean, we need to be smarter on the smart technology, or usage of the smart technology also.
Yeah, and it's going to be most useful when the supply-demand gap is the highest, which, as you mentioned, is in Tier 2 and Tier 3 cities, right? And I've actually firsthand, and I'm not a doctor, I'm not coming from a medical profession, for me it was fascinating to see what they're calling an EICU at Fortis in their fMRI center in Gurgaon, where they're looking at medical records of patients from places as far as Raigad and Raipur and Amritsar and so on, and it actually works. Obviously, it's not a star doctor on this end of the table, but I think it's a good doctor from an institution that people trust, and the patients are from cities where, in many cases, even the most basic of services are not available to them, and therefore it works, I guess. So, I mean, moving on, I want to take your views on how does all this come together? Doing all this is a lot of work. But even if a patient, if a hospital does all this, put the right technology in place, put the right infrastructure in place, find a way to get to a return on capital that makes sense for the investor, how does it impact the ultimate patient? How does this customer experience change because of all this? Because the expectations of the patient, he's not thinking about your return on capital. He's not thinking about, are you utilizing your doctors properly? And in situations where the patient is in a serious condition, there's only one thing that is in his mind. So how do you bring all this together to improve the experience of the patient overall, so that he feels satisfied and leaves with a happy impression or a good impression of the hospital?
So, like you said, a patient comes to a hospital. Of course, patient may or may not be aware of maybe conscious or unconscious, but the family members around. So it's a very stressed out situation, whether they've come for OPD consultation or for admission, both ways, very stressed out. And so when it is stressed out, any small thing bothers them. And that just gets escalated. So one of the things which you see in many hospitals is the queue. First thing you enter is a queue. So there is a queue, and then there is crowding, and then you have to wait. The standard things in a hospital. So I'll give you an example of what we did. We took the example of, many of you use that movie booking app. And, you book it on your mobile, and you just go to the movie theater, just show it, and you don't need a physical ticket, right? You don't need to stand in a queue to buy a ticket. So we started this. So we said, okay, why do I need to ask somebody to stand in a queue? So now, for example, there is online payment. You can do online, and you can go straight to the consultant room. You don't need to stand in a queue. And of course, not many people in the country are, although we have 29-30% people using smartphones, but still many people are not tech savvy. So for them, we have kiosks. So you have kiosks all around. So it just reduces the time a little bit. The other thing, which is now with the new generation of people. So one thing to understand from a hospital perspective, it's a little different from understanding. So we are a young nation, right? So we have 65% less than 30 or 35 years age. But the people who come to the hospital are not in that age group. Majority are of a higher age group. So they may or may not know the technology. If they are accompanied by a younger one, yes. Otherwise, no. So what happens is, how much technology you can use, it has to be very subtle. So that is one thing which we need to be aware of. The other thing is, patients now are starting to look at, they are assuming, it's taken for granted, I'll go to a hospital, I will get well and come back. But now I need this experience around me. So if you think of it from a inpatient perspective, out of 24 hours, the consultant or the doctor may visit the patient maybe once or twice, half an hour maximum. So 23 and a half hours is something else, which is the nurses, which is the attendants, which is the ward boy, the AC, the TV, food, and so on and on. So you need to be careful about these services and how you can enhance the patient experience and also the relatives' experience. Because the patient's relatives they complain more than the patients, right? So that you have to be careful about. The other thing is, from a patient perspective, imagine an ICU where you have patient there and you have all kinds of cables and wires and equipment attached. And if I remove all that, so this is just what is called a smart. So if I have a smart wear, if I have a smart uniform with sensors and it is monitoring everything, so it's like a clean, clean look. And of course the patient, not in the ICU but in the wards, they can move around. And if it is tracked at the central nurse station, you can see how much the patient experience is improved. And the reason why I'm telling you all this is, patients now are expecting this. Because what is happening is, when they go to a mall, they go to a movie theater, when they go to a hotel, the same thing they want here. I mean, on a lighter side, I've got patients who say, I'm not coming to your hospital because you don't serve me non-veg. And I have told them, please get well, then eat non-veg outside. But the demands are like that. And I mean, free Wi-Fi is what they will expect and so on. I mean, I can go on and on, but I'm saying that there is an important thing like that. For example, now, one more minute I'll take, is that earlier we used to take feedback on the forms, right? You can fill a form and customer feedback. It will reach us whenever it reaches us. But now technology is there, now it's all on tabs, and it's online, instantly it comes to us. So patients also know that, if I say it, I know it will reach. So that is a good way of doing it. Now we have installed, like a one-touch service. So they don't need to run around, just one touch and they can say, I have this problem, that problem. And you can fix that. And so there are many things like that, but the important thing is to ensure that whatever we do in a hospital, patient care and patient comfort and the relatives' comfort is paramount. So,
I just want to add that when we first invested in Fortis, they were in the process of completing their facility in Gurgaon, the fMRI facility. Well, the capital investment relative to most other average hospitals there was higher, but the focus there was completely on the experience of the patient and the experience of the people that came with them. I'll give you some examples of small things that they've done. For example, the rooms in which the patients are seated is completely glass paneled. So if you're sitting there, or lying down on a bed for 2 or 3 days, there's enough sunlight that comes to you and you're not surrounded by 4 walls. There is a theater there for relatives of patients who are sitting there for 2 or 3 days with nothing much to do. There's reclining chairs for people who want to sleep in the hospital because they're concerned about the patient and they want to stay close to them. So there's a lot of things. There's a spa for people, for them to spend their time in if they really want to, right? The point here is, we were a little not sure if this is all going to make sense from the return on capital perspective, which was the first point of the discussion that we had. But frankly, it's actually worked out far better than we expected, and people actually value this kind of additional amenities that actually goes to enhance their experience of the hospital.
Actually, it's not only the experience. There is some data available that the patient healing is faster. And for example, I'll just add one that we have the benefit of the sea close to our hospital. So, for example, our chemotherapy unit, we put it on the 14th floor, and all of them overlook the sea. So when a patient comes, so you can, you overlook the sea, and it's nice environment, green, and many of our patient rooms overlook the sea. So what we've sometimes heard from patient is, oh, it's so nice and relaxing to look out. So that also helps the healing.
Sure. How does this concept of patient experience vary for I guess nephrology is a slightly different segment from a typical multi-specialty hospital. What are some nuances to that patient experience relative to a hospital?
So in terms of, let me start with what's similar. I think the one which is similar, and I think moving forward will become even more important, is while we do want to make sure that the overall experience is good, ultimately the patient and the patient's family has significant access to data and information. So they know what are the things that should matter ultimately in terms of the results, right? So the clinical data or the success metrics, so to speak. What we're seeing slowly happen both in a lot of hospitals and single specialty chains is they are sharing that with the public and saying, look, we are, judge us, yes, our services are great. I mean, the additional amenities we provide are fantastic, but ultimately the clinical outcomes which matter to you are also something which works well. And most people who actually have started tracking and measuring it. One of the challenges was you didn't necessarily have that data even within the hospital or within the chain. If you were to switch and move specifically to in a single specialty chain, and if you take nephrology, in most cases it's a shorter stay, right? So in the case of when you're on dialysis, you're there for 4 hours, but you're there for 4 hours and you're there twice a week, and unfortunately you're there for the rest of your life unless you have a kidney transplant. So I think what Gautam said again holds true, which is your experience when you're on that bed, and it's sometimes you might not have the benefit of a nice view, but at least how your staff is trained, how they treat you. In fact, one of the things which we didn't realize mattered a lot, and we got this when we ran a patient survey in this company, NephroPlus, was they don't call the patients, they call them guests. And so their view is, and we thought it's a small thing, but when we got the survey back from the patients, they said the one thing that they valued the most, apart from, they didn't talk about the quality, they didn't talk about the fact that there's no cross-infection. They talked about the fact that when we are in this place, we're treated as a guest. It's almost hospitality. It's no longer a hospital. And I think that nuance, I think it's true whether you're in a hospital or in single specialty, but it becomes even more important in places where there's, like in the case of nephrology, where it's recurring, right? So you're going to be there for a long period of time, and you're sticky because you need to be there, but that little things ultimately matter in terms of the experience.
Can I just add one thing?
Sure.
So based on just getting an idea based on this, one thing which we started, and we were not so sure how successful it will be, but it's a very simple thing that, when the patients come for consultation and the doctor is delayed, and doctor can be delayed for many reasons, and simple thing of sending a text message that your doctor is delayed by 2 hours, 1 hour, 30 minutes, or whatever it is, it has enhanced the patient satisfaction levels significantly because they now understand. So it's a simple thing. And the other thing about, when the appointment is confirmed, a text message following up, and text message after the appointment done for feedback, these things add up. And what we also heard is, and especially in Bombay, commuting is a big problem. So if you go and do a test, you need to get the reports, right? So simple thing of online reports, online access to your data, I think it really adds to the patient experience.
Makes a lot of sense. That brings us to the end of our timing for the session, but I'll summarize very quickly. I think the summary of all that we're saying is it's important to focus on the patient experience and make sure we enhance patient experience. But this has to be done while keeping in mind that return on capital of whatever investment that you make is actually decent enough for investors to be interested in expanding these facilities and hospitals, for it to be much more sustainable in the long run. And ultimately, how do you achieve that? It's not important that you have all kinds of the latest gadgets and technology without actually thinking through if you truly need it, but actually being much more smarter on process, on small things like how do you make the patient understand that we actually care for their experience and their ultimate health. And thinking through the fact that it has to be thought through from end to end, from the start to the finish, and create a virtuous cycle, as opposed to fixing individual pieces across the cycle.